Natasha. Welcome. Thank you all for being here today. I am Dr. Natasha D. Jarnett, and before I introduce Peterson, I have a couple points. Today's workshop, Climate Change is Health, Extreme Weather, Vulnerable Populations, and the Many Benefits of Taking Action, will provide information on how extreme weather puts vulnerable populations at greater risk. But first, here's some housekeeping items. Our online viewers can ask a question at any point during the workshop by entering it in the comment box on the right-hand side of your screen. Also, those in the room, we welcome you to raise your hand to ask questions. And if you're comfortable, we would like to pull you forward towards the mic so that the online audience will be able to hear you. The slides and archive recording will be available shortly after today's presentation. And finally, a survey link will be shared at the end of the workshop. Please take a moment to fill out this short but important questionnaire to help us improve future workshops. And those in the room have the same questionnaire, but on paper. Without further ado, I'd like to introduce Peterson Toscano. Peterson's unique personal journey led him to performance art. After spending 17 years and over $30,000 on 3 continents attempting to de-gay himself through gay conversion therapy, he came to his senses and came out a quirky, queer, Quaker concerned with human rights and comedy. He asked himself and his audience unusual questions. Who are the gender outlaws of the Bible? What is a queer response to climate change? How can comedy help us better understand tragic losses? Using theater, comedy, and storytelling, Peterson explores LGBTQ issues, privilege, religion, and climate change. In 2017, Peterson produced Transfigurations, Transgressing Gender in the Bible, a film that reveals gender non-conforming characters. In addition to being a group leader for Citizens Climate Lobby, he is also host of Citizens Climate Radio. Peterson lives in Sunbury, Pennsylvania, with his partner, South African author Glenn Retief. So, fun facts about Peterson: he is an avid musician. And so he set out to become a flute player. And that's what he just knew he was going to do. And he went to the band and they said, we don't need a flute, we need a tuba. And if you're familiar with music, that's practically the opposite. So he became an amazing tuba player and has performed all across the US, even at Rockefeller Center, and has performed internationally as well. So what seems like a setback was certainly a setup for awesomeness. And also, something that I envy about Peterson, he grew up in a restaurant. If you know me, I would have loved to have grown up in a restaurant. His parents are restaurant owners in upstate New York, so he literally grew up in the restaurant. And when I first met him, I said, he's so personal. He seems like he's really listening to me. And I think he is. And I think that I think that his restaurant experiences, talking to tourists, regulars, getting to know the people at the restaurant on, day by day, I think that serves him very well in getting to know people and understanding people. And it serves him very well in his current work. So I'm excited to have another opportunity to work with Peterson. Last year, he interviewed me for episode 6 of Citizens Climate Radio, and we had a fantastic time. So if you haven't seen him or haven't heard his work before, you are in for a treat today. So with that, I'll turn it over to Peterson. Thank you for being here.
Thanks, Natasha. Thank you, everyone. It's really great to be here. And because of Citizens Climate Radio, we got to meet and we chatted, and I was just so impressed with Dr. Natasha D. Jarnett. And not just what she said, because it was amazing what she said, but like, I don't know, we just did this radio interview, but I immediately thought I need to see her in front of an audience because, some people are just, you could just tell they connect well with people. And that was really clear to me. Natasha has a very impressive resume. She's a graduate of the University of Louisville and holds degrees, PhD, master's degree in public health with a concentration on environmental health science. She's continued her studies and investigated cardiovascular risks of air pollution exposure and has been awarded an Impact Award in 2015 from the Society of Toxicology. Now, in the theater world where I kind of come from, we have this expression of someone who is a triple threat. meaning they could sing, dance, and act. And unbeknownst to most of her colleagues, Natasha also is somewhat of a triple threat. In addition to being an amazing scholar and presenter, she's also an athlete. And in fact, she's a record holder for the triple jump back in the day. And she's also a musician, playing piano and saxophone in both the concert band and the marching band. I wonder if you would combine your track and field with your saxophone and like maybe create a running band. That could be kind of interesting. But early on, it was obvious that she was going places. And in fact, back in the day, she's the winner of the Youth of Achievers Award back in the day, which was just not too long ago, actually. So Natasha, when I heard her speak for the radio, I said, we need to do a presentation together, and we put our heads together and found many shared interests. So in our agenda today, we're going to break it down, and the first thing is that Natasha's going to talk about the health risks of weather, and sort of give you a little bit of an overview of that, and then I'll slip in and bring it in more specifically to some vulnerable populations, particularly LGBTQ populations, but others as well. So please come back and tell us more.
Thank you. So the science is clear. Climate change is a serious threat to human health, and it can affect our health by way of harming our air supply, our water supply, increasing vector-borne disease, and increasing extreme weather events. As an APHA priority, we believe in the need for interventions and actions that protect human health against climate change, and public health practitioners play a critical role in doing so. Today's workshop, Climate Change is Health, Extreme Weather, Vulnerable Populations, and the Many Benefits of Taking Action, is part of the Year of Climate Change and Health workshop series. The Year of Climate Change and Health is an APHA-led initiative with the goals of raising awareness of the health impacts of climate change and mobilizing action on climate. Each month we've had a different theme that has been decided upon from our partners and members, and this month's theme is #ActOnClimate. In addition to this workshop, other December activities will include a webinar, also a Twitter chat, and then there will be several blog posts. Please visit apha.org/climate to stay up to date on Year of Climate Change and Health activities. Each month, our partners come together to determine the month's activities. And it's not too late to get involved with the Year of Climate Change and Health. Whether partnering as an individual or an organization, your contribution is invaluable. Bronze partners, for example, can help share information with their networks or make lifestyle changes. Silver partners can assist in planning monthly activities like the one here, and also doing energy saving features in their homes. And then gold partners may participate in bronze or silver activities, and also participate in creating a meeting theme or a conference themed on climate change, or writing letters to the editor. Please visit apha.org for more and to become a partner. So climate change is health by bringing about precipitation extremes. So on one hand, we'll have increased extreme rainfall events, so severe storms and flooding, and this may leave in its aftermath mold exposure, which puts asthmatics at higher risk of complications. And then on the other hand, climate change causes drought, the other precipitation extreme. There's an absence of the rainfall, and so in drought, we're at much higher risk for wildfires. And this is unfortunately very timely for what we're dealing with today. We're hearing about these awful wildfires in Southern California. And so certainly our thoughts are with our friends and family members that are there now. I actually have family that evacuated their home 2 days ago. So it's real, it's happening. And these things have serious threats to our health, including asthma, heart disease, and mental health. So it's not just the physical health impacts of climate change, it also affects our mental health. So when we have these extreme weather periods, we're more likely to have stress and anxiety. And when we we survive them, we're also, depending on our circumstances, we may have post-traumatic stress disorder or PTSD. And flooding increases our risk of exposure to contaminants. So when we have an increase in flooding, or increased snowfall, or heavy snowfall, I should say, this may overflow our stormwater source system. And this will, if it overflows, it will push contaminants untreated directly into our water supply. And this increases our risk of gastrointestinal illness. And research has shown that just over half of water disease outbreaks were preceded by extreme precipitation events. So I wanted to share with you this helpful infographic that we have that connects climate change with extreme water and health impacts. We worked on this with Climate Nexus, and we'd love for you to go to apha.org, download and share this. It's readily available to share on social media. So extreme weather will happen, but climate change is making the occurrence of severe weather more frequent and more intense. And it's causing us to have property loss and damage to our properties. But it's also causing a loss of access to our needed services. After these events, we may not be able to access roadways. We may not be able to access needed medical care, treatment, or even get our medications. In addition, some people may not be able to evacuate. And then some people may have fear about evacuating with the threat of job loss. And then some jobs may not return after extreme weather devastation. And then people also may be displaced, and this causes them to lose their social ties and their community bonds. So we're all at risk for these in extreme weather, but these threats are exacerbated more so by the health threats of our vulnerable population. They're at even higher risk. And though many of these vulnerable populations may be very resilient, their communities may lack the infrastructure to rebound quickly, or resources to do so. And that may be the case for impoverished communities or communities of color. They may not be able to speak for themselves or act in their best interests, as may be the case for children. They may not have support, or they may have physical limitations, as is the case with the elderly or disabled persons. And then they may be ostracized or have unique needs, as Peterson will explore, among undocumented residents and LGBTQ persons. Overall, pre-existing disparities among vulnerable population make the risk of extreme weather even more hazardous. And with that, I'll turn it over to Peterson.
Now, I have to admit that climate change and public health have never part of my world and was not on my radar. I'm an LGBTQ human rights person who's also a Bible scholar and a comic. It sort of never fell into my realm. But a couple of years ago, I began to be concerned about climate change as a human rights issue, when I began to see that, oh, this affects people and it affects them in a disproportionate way, that some people suffer more than others. There's a kind of a systemic unfairness about it. And this we see particularly in the United States when it comes to extreme weather events. I mean, you just think about it. If you're in a community and there's a big event like a flood, well, your experience will be different if you own a property as opposed to if you rent a property. You know, the resources that you have afterwards, the ability to recover, having a sense of place can change just because if you own or if you rent. And so when I began to look into climate change, one of the first questions that popped into my head is, what is a queer response to climate change? Which my partner just thought I had lost my mind. He's like, what are you talking about? Queer? And I was like, there's something about this that I think it may affect some of us differently. And I think we may have some things to contribute to this conversation based on our experience in the world. And so I took time to kind of sit with that question. And the one thing that I've begun to think about is, when you think of any population, any person, if they're having a hard time when it's nice weather out, when it's a nice day out, if they're experiencing difficulty because they don't have legal documentation, if they're having problems with the police when it's a nice day out, when they're experiencing problems with the healthcare system when it's a nice day out, well, when these storms come, just like these storms are getting bigger, their problems get bigger. And in particular, I'm thinking about a couple of populations of folks that they would maybe have a different experience. So I think about LGBTQ youth. So in every city in the United States, there are people living on the streets. Up to 40% of homeless youth right here in DC are lesbian, gay, bisexual, transgender, gender non-binary, queer kids. So these are the kids who are like, I can't stay at home anymore. It's not safe in my community. I'm going to find refuge in a city. And they come to a city like this. But it's an interesting population because often they avoid going to shelters. There are youth shelters, but they don't necessarily always feel like safe spaces because many shelters are run by religious organizations. And if you're LGBTQ, you're not quite sure how you're going to be received. And many of these shelters, most of them are highly gendered spaces. Boys there, girls there. Well, if you're transgender or you're gender non-binary or gender queer, meaning that you don't really identify as male or female, well, who gets to decide where you go? You may say, well, I'm a girl. Well, and they're like, well, your ID doesn't say that. You have to go with the boys. And there's hassles. And people are afraid, rightfully so, that they may have a humiliating and even potentially dangerous experience. So a lot of times LGBTQ kids don't go to shelters. So the question I have is, what happens when the storms come? And a lot of these young people don't have firsthand experience of how dangerous these events can be. And it's not just the initial storm, but the flooding often that comes afterwards from a hurricane, for instance. Where do they go? Do we know? Do we have shelters even emergency shelters that are specifically designed to reach out to this specific population, which is a large population proportionally of youth? To me, that's a queer family values issue. There's another population that so often gets overlooked, and that's LGBTQ senior citizens. Many of them have experienced a lifetime of discrimination, maybe estranged from family, may have been married at some point to someone of the opposite sex and have children, but came out and then lost a lot of those connections. So more isolated. And they don't have necessarily people checking in. They may not have their children. Most don't have children. Often this population avoids going into retirement communities as well, because many retirement communities, you can't get to choose your neighbors there in the same way. And many seniors find they have to go back into the closet when they go into a nursing home or a retirement community. And because you have people caring for you who may feel opposed to who you are, and you're at the most vulnerable part of your life. Similarly, this population has less money than non-LGBTQ seniors. They may have been unemployed or underemployed for much of their life. They may have had a long-term partner but never received Social Security benefits after that person passed away. In some cases, I've heard stories of a partner dying and the partner's birth family coming and just taking stuff away, and there's no legal recourse. Things have changed legally recently, but that's only very recently. So my question is, with this population, what happens during extreme heat events? Because the most vulnerable people in extreme heat events are the very young, the very old, and people with respiratory problems. And when it gets really hot, like over 95 degrees, it becomes fatal. And the only real solution is you run your AC 24/7, which is expensive, and not everyone can afford to do that. And my question is, like, are people checking in with these LGBTQ seniors? Do we have a list of all these seniors in our community that we can kind of check in with? And what I think is, if we do, we also then have the ability to build community in such a wonderful way, even on good days, even when we don't have extreme weather events. During Hurricane Harvey in Houston, there was a story that got buried that I came across, and that was in the Bay Area in San Francisco. There was a freak heat wave where it got up to 104 degrees. Now, I don't know any of you watching online here, how many of you have been to San Francisco before? Do you remember it being 104 degrees ever? I mean, it's like July is the coldest month, right? And so most people don't have an AC there. And during that event, 6 senior citizens died because they didn't have air conditioning. And to me, this is another queer family values issue, to recognize that these are folks that don't have the same equality in the world because of their life experience, and we can look at this in advance and to connect with these populations so that they're safer, and that the community is stronger. And then add other parts to this, right? I mean, the more identities you add, the more discrimination someone might face. So if you're a queer person of color who's undocumented, well, then you've got this whole array of issues that you have to face during a time of extreme weather events. So what I'm seeing that with climate change, that we all experience extreme weather events. Like if you live in a community that has it, we all suffer one way or another. In a way, we're all in the same boat together. We're just not all on the same deck. And I think that's what's important to recognize, that we have the ability to connect with people in the community, find out what their lived experiences are, the sort of challenges they face on sunny days, and then begin to find out, well, what's the experience like when these extreme weather events come? Because they're here, they're going to continue. And to me, it's an amazing opportunity to bring to the forefront lots of people to share their experiences and then build stronger, more resilient communities. And in part, what we want here is not to just tell you all stuff that we've been thinking about, but really we recognize that there's a lot of wisdom and experience both online and in this room. And a lot of what's needed in climate conversations is imagination and just sort of dreaming and thinking and imagining. So we're going to have this next part of this time be a workshop where you actually are going to work in groups and sort of work on some scenarios based on what you know and just your own imagination. So when you walked in the door, you got a color-coded piece of paper. Find that. And if you don't have one, raise your hand and we will get you one. We need one here and one here. Everyone, there are 5 different scenarios, and these are, and for you folks online, you're going to get yourself a scenario in a moment. What could you put up scenario number 5 for me, please? You're each going to get a scenario. We're going to work in groups of 3, no more than 4. And these scenarios represent fictional people in Houston who, this just gives you a little biographical detail about them. So for instance, scenario number 5 that the online folks are going to look at is Diana, who's an 84-year-old trans woman who lives alone since her partner Susan passed away in 2010. She lives on a tight budget and receives only her own Social Security benefits since she was not eligible to receive those of her partner for 43 years. She requires a walker and at times a wheelchair to get around. And so there are 5 of these scenarios of all different people, and your job is in your group to get together and imagine during Hurricane Harvey, what might the challenges be that Diana might face, or whoever the person is that you're looking at. What sort of challenges might they have that someone who's maybe different from them won't have? And so there's a discussion question. In addition to the risks and difficulties that come to most people who are in the hurricane's path, how might this storm affect the people in your scenario differently? What other challenges might they face? Or even what challenges that they might face that other people have but will be even bigger and harder to navigate? So hold up your paper for a moment so you can begin to see who has a similar color. All right? And when I say go, I want you to find 2 other people, maybe 3 the most, and get into groups and just begin to discuss it. You'll have about 7 minutes to sort of discuss and write down what you think this person might experience. And when you get together, first thing you do, look over your scenario, make sure you understand it. So is that all clear what you're going to do? All right, and for the folks online, I'll talk to you directly and we'll work it through and you can send in your comments. So go find some partners, spread out as much as you like, and we'll be back here in about 7 minutes to talk about it. Hello, online folks. How are you doing? Have we been getting any comments from folks yet? So what we're going to do is discuss this scenario of Diana. And so I want to give you a chance to sort of kind of look at that. And through the chat feature, I want you to begin to send through either questions you have, but more importantly, ideas of what you think Diana might experience during Hurricane Harvey. And what challenges might she have had? And I have assistants here who will help me and read out things. Do you have anything to share yet?
No, so far we only have one comment, but it's not related to the scenario, just saying that Bangladesh is one of the most vulnerable countries to climate change.
Yeah, that's true. And as Amitav Ghosh wrote about, like, partly, you've got these cities that are right there close to the ocean, which is a vestige of colonialism in a way, because you needed to put these cities. So Boston is another one, Miami. These were cities that were put in vulnerable places because of colonialism, so you can get closer to them. But now they are the most vulnerable places, including New York.
So we have a few comments now from the chat. We have one person saying social isolation, fear, shock, and a question from Amy asking if she is on hormonal medication.
Yeah, and that's a good question about medication, because this is true of everyone on medication, right? If you are, have HIV medication, this is true of people who are recovering addicts who have special medication that they need to take in order to, to kind of help them with that recovery. And for some trans people, not all, but for some trans people, there's hormone replacement therapy where they're on hormones. And one of the special things about trans people is they often have had horrible experiences with healthcare, even when they're just going for like the flu, that they can have really humiliating experiences. So it can take them years to find a trusted general practitioner. And sometimes they'll travel an hour or two to get to that person. And so when people get displaced, when traveling around a city gets hard, I mean, for a trans person, who maybe just has a cut on their leg, they really often have to navigate, like, do I go to the emergency clinic that's being set up, or am I going to have more problems that's not worth it?
Now we have a few more comments. Irina says, more difficult transport if she does not have a car, getting to and onto the bus, probably more difficulty affording the bus, probably more difficulty having a safe place to go. Nisha says, evacuating with mobility issues. Gabrielle says, losing electricity poses all types of problems.
Yeah, and of course, it's hard for lots of people, right, who are not as easily mobile and who are older, but not always, but often, you have younger relatives who can come in and check in and say, well, how's mom doing? How's how's my sister doing? But a lot of times with older LGBTQ people, they've lived for years estranged from family, and so that family infrastructure isn't naturally there. This is true of other seniors as well, for sure, but it is a regular feature often with older LGBTQ people. Other comments coming in?
Fiona says it seems like she would have difficulty evacuating given her limited mobility, and perhaps she feels isolated in her community and would have a more difficult time asking for help. Charlotte says loneliness. Her partner has passed away, and the community of rescue workers and volunteer assistants may not truly understand or relate to her needs. And Donna talks a bit about her communications. Internet, cable, smartphone may be limited due to costs.
Oh, that's a part I hadn't thought about, but yeah, that's true. Maybe having a limited number of minutes on the phone, and as people on limited budget, they don't, she would have some challenges in addition to the electricity being out. She may have one advantage, is that she might have a landline that still might work, which sometimes happens when the electricity goes out, that the landline still works. One of those things that's harder and harder to find is a landline. But definitely the accessibility issues and getting around is going to be a challenge for sure. And then, being a trans woman, there's a lot of violence towards trans people in the United States, and within her own world, where she has a little bit more control of who she's around and who she sees, suddenly she's going to be tossed into a fairly chaotic situation, perhaps at a shelter, where again she may be challenged of where she's staying in that shelter, emergency shelter. If she she's like wants to be housed with the women because she's a woman, someone might challenge her about that and what what restroom facility she's using. And then there's the basic privacy of that, which privacy is hard to begin with, but also if you're trans and maybe have not had surgeries and people are seeing your body, it can be very, very complicated and potentially dangerous.
Yeah, we had a few comments around that issue of medical discrimination if she needs medical care. Let's see. A lack of a safe space and a potential hesitation to reach out for help as a result.
Great. And you folks online, you're able to hear us okay, right? I'm assuming. If you're having a problem, please alert us to any of that. Yeah, but definitely the housing, the medical care, these are two issues that can become very dicey for someone like Susan, for sure. And in a moment, we're going to have a question where we're going to talk about what are some of the possible solutions. So you can start thinking about that. What are some of these solutions, for sure. Now, I'm assuming that she's connected with other people in the community, other LGBTQ people, but of course what happens is one gets older, you begin to lose more and more friends. So what may have been a very strong, closely knitted community may not be anymore because people have moved on to other places. You're doing great work out there online. I'm so excited. These comments are just flying in. Do you have more you want to share? Why don't you introduce yourself as well so people know who you are, fabulous voice.
And hi, my name is Ivana Castellanos. I'm a policy analyst here with APHA Center for Public Health Policy. We do have many, probably more than I can go through, comments on our chat. So thanks everyone online for providing such a vibrant chat. But we have a comment from Nishi regarding issues of ID are common. Does her ID reflect her gender identity, current name, etc.? If not, might have issues using shelters, accessing medical care, or applying for assistance to repair her home.
Yeah, legal documentation can be very dicey, and this is actually state by state. It's different. Some states makes it very hard or virtually impossible to change your gender marker on your ID, and I don't know what the laws are actually in Texas, but this can become really challenging. And so when someone has to show their ID, that could open up a whole other can of worms where people then start asking inappropriate questions, might harass the person. And so some of the other scenarios we're going to look at are also talking about people who are undocumented residents. And so they're facing issues. And they're facing issues where they're afraid of deportation or other legal issues. So they may avoid getting the help they need during an extreme weather event because of that. We have about 3 more minutes of this discussion, and then we're going to have a group share with the other participants to hear what they've come up with. But do you have any questions as well as comments about this scenario? Feel free to share them.
So we did have one question earlier on, and it was, let me just try to find it, but it was regarding, oops, I had it and I lost it. But whether if this is something that is prepared for, discussed in disaster planning.
This is a great question, because during pre-disaster planning, what's so critical is to bring all the voices to the table. And I know in looking at what happened in Katrina over 10 years ago now, and this most recent storms, they do an assessment, right? What was overlooked? What did we not think about? Who wasn't included in the conversation? And I think, as in many areas of urban planning and all, LGBTQ people may not be always included, and there are certain populations that are marginalized that don't have the political power or the access, or if so, some more than others. So, like, you might have the more wealthy gays and lesbians being part of the conversation, or even part of elected officials, but the more marginalized people, trans people of color, LGBTQ youth, they're not necessarily there. So there needs to be some real clear intention of bringing as many voices to the table. And one of the things that is happening, we're seeing more and more of, is in looking at these recent extreme weather events, really more questioning what happens. But there is no, as far as I can tell, there's no national movement yet to specifically look at LGBTQ people and extreme weather event, or even undocumented residents. And so part of the job, I think, is for people in your own community to raise this question, because if no one raises the question, there's no way that people would know about it, and lobby people at FEMA, and every town has to have some sort of a disaster plan. Ask to see it, and if you don't see somebody on there that is reflected in it, you should say something, and I think people would be really actually happy to hear more about that. Any final thoughts here before we move to our next section?
We did have one comment talking a little bit about how Diana might have had limited preparation even in advance of the hurricane due to some of her mobility issues, like preparing and collecting canned foods, water, dry foods, which may mean that she would not be able to wait as long for emergency help.
No, we didn't add this one other thing, but if Diana had a pet, that can be a whole other thing, and having pets in extreme weather events can be really complicated. Okay, so we're going to bring everyone back in.
We're bringing everybody back together.
All right.
All right, time's up, everyone. Hopefully every group has appointed somebody to share and report out. We're going to need that person to come to the microphone.
We'll make sure you don't get on the screen, because I know people are a little nervous about that. So what's going to happen next? Can we have all your attention, please? All right, we're coming back together now. And I know there's a lot to talk about. There's one group that, So what we want to do is some kind of group sharing to kind of hear what sort of insights, wisdom, experience has come up. And we have the different scenarios that we can put up on the screen when you talk about your scenario. And everyone has it in front of them, the people who are here in the group. And we just have this mic so that people can hear. We won't, you don't have to actually be on the screen, so don't be nervous about coming forward. But who has scenario number 1 of Luce and would like to share some of what you think Luce would have experienced? You want to say just a few words about Luce as well?
Sure. I can read the description.
And you can read it. They'll have it. But
okay.
I want to see what stood out for you.
Yeah, so Luce is a 29-year-old mother of 3 children. 2 of her children were born in the USA, and her husband, Octavio, is currently in California. They're both undocumented residents. So what we came up with as far as what Luce might be facing during Hurricane Harvey, one sort of big news story that came out of Hurricane Harvey was the fact that the Texas Border Patrol did not shut down their operations during the disaster. So she could have run into concerns, if she was going to run into a checkpoint during the evacuation. That drew lots of criticism from human rights organizations, and so would potentially be an issue for Luce and her family. Another issue potentially could be a language barrier. She's not able to communicate as effectively during the evacuation, or to navigate the information that's being disseminated as far as evacuation notices, where resources are available, and other recovery resources, just navigating that sort of information barrier. The family support system might not be there for Luce. Obviously, her husband is not in the area. She might not have as much family in the area, especially if she's an immigrant. She could be concerned about her family being split up. If 2 out of her 3 children were born in the U.S., that could be a concern for her as well. And then just sort of explaining that situation to children of that age could be certainly difficult. 4, 7, and 10, that's sort of a big thing for kids of that age. If they're wondering what's happening with their classmates and seeing them evacuate, it could be a difficult social situation for her to navigate as well.
Great. Thank you so much. And any other group had 1? We all sort of broke up evenly, I see. Very good, very smart. And I was wondering too about like housing. If they own, they rent, do they have a place to come back to after evacuating? That's a big question, of course, for potentially for them. So let's move on to scenario number 2. Who has scenario number 2? All right, you ready to share? You can just sit right there. You don't have to get up if you don't want to.
Okay, I'll read scenario number 2. Clara, a 19-year-old mixed-race trans woman, currently out of work and recently forced to leave her parents' home. She has been homeless for 8 months, staying with friends whenever possible. She has avoided shelters. She has most recently stayed with Spencer, a gender non-binary Latinx friend who has a small studio apartment near the Buffalo Bayou. And our group developed a list of risks and difficulties that Clara might face. The first that we thought is that because she's avoided shelters before, during Hurricane Harvey, she might also avoid going to emergency shelters. Another thing we thought is that during hurricanes or extreme events, often just the experience of a hurricane is scary and can cause stress and emotional tension, and that she might not have as strong of a social network for coping mentally and emotionally. Another thing we thought is that the description says she stayed with friends before, but during the storm, many of her friends could have evacuated and may or may not return to the city after the storm. And so this could kind of decrease the resilience that she had been relying on before. Something else that came up was that she is a mixed race woman, and discrimination from potentially her friends' parents might also be an issue in terms of her thinking of places to live, considering she's 19 years old. A lot of her friends might live with their parents. And we have a few others, but I think that covers our responses.
Very thorough. Well done. So our next scenario 3, who has 3? Who's our scenario 3 people? and you can over there, you can speak loud enough so everyone can hear you.
Sure. So our character was Xander, a 16-year-old genderqueer teen from a tribe located near El Paso. Xander moved to Houston, we don't know how long ago, and has been living on the streets connecting with other queer people. Xander also suffers from asthma and does not have health care. One of the things that jumped out at us right away is that without access to health care, and given Xander's age, there's a question of whether shelters or hospitals would treat Xander without contacting his or her parents. And we didn't make an assumption about how Xander identifies, so excuse the pronouns. But even if Xander has access to a shelter or a hospital, in an emergency situation with an asthma attack, given his or her age and potential social connections, getting to a hospital in time to get treatment might be really difficult. Asthma, of course, during the heat after a hurricane, or if there's toxic releases, as we saw during the case of Hurricane Harvey, lots of vulnerability there. Let's see what else. Xander might not have an ID that matches his or her identification personally, and so that could cause problems getting again into shelters or getting hospital care.
We started to make some assumptions, presumptions about culture. So we just thought about culture and cultural context, both for the helper, for Xander, and how that might impact future decisions and decision making by decision makers.
I think that's it.
Thank you all very much for sharing your thoughts on scenario 3. Certainly the age and cultural context are very important as we consider Xander's situation. Who has scenario 4? Okay, we may need someone to come up a little bit closer. Thank you. Perfect.
Okay, so We had scenario 4, which had Brandon, who's 34 years old, an activist and an educator living in Houston, Texas, a Black female to male gay man. His research focuses on the intersections of race, gender, and sexuality. He works with LGBTQ students, particularly LGBTQ students of color, at a college in Houston. So we don't know whether he rents or owns. We don't know what his salary is, but we do know that he's an educator. Don't know if he's full-time. Don't know what his healthcare status is. But we did quite immediately come to the conclusion that, of course, being Texas, that there would be racism issues. There would be the fact that he's LGBTQ, female to male, gay man, and that some of the issues that may be different for him is that he may have certain hormones that he's on, that he might be much more susceptible to certain things that are in that toxic water than things that were released when there was the flooding of 52 inches. Also may have some mental health stress dealing with maybe not just his issues, but the students that he works with. So he may have a lot of mental health problems, and if he's on psychotropic drugs for dealing with these issues, the heat, if there were heat, he's going to also have that interaction that's a problem. And then we also thought of him, he might be even a caregiver and a leader. So many people who may be experiencing the same problems that he is, he may have got it 1,000-fold more just because of the people he cares about. And then I guess the shelter issue too, if the place where he had to evacuate to was not so sensitive to people who are of color or LGBTQ, it might be a very stressful situation. So, thank you.
Thank you. Thank you very much for sharing from scenario 4 and the racism, and that he may not have access to his medications during this time are two very important concerns. Now, who has scenario 5? I know our online audience has scenario 5, and we will hear from them shortly, but who in the room has scenario 5? All right.
Hello, so we have scenario 5, Diana, the 84-year-old trans woman who lives alone since her partner Susan passed away in 2010. She lives on a tight budget and receives only her own Social Security benefits since she was not eligible to receive those of her partner of 43 years. She requires a walker and at times a wheelchair to get around. So we discussed from the back, she has mobility issues, so even being evacuated is going to be an issue for her. That she might face shelter discrimination because she is trans. There's also the issue that she's low income, so can she rebuild afterwards? Can she find shelter? There's the issue that a couple other groups mentioned about does she have the ID? Does her current gender identity correspond with her ID, and how that might affect her Social Security benefits. There's also, she has a risk since she's older, maybe she's at risk for mental health issues down the line, or even susceptibility to like water contamination, that sort of thing. Also, maybe she's even resistant to evacuate in the first place because she did lose her partner, and assuming that she and her partner lived together for 43 years, maybe the home has sentimental value and she doesn't even want to leave. And then also, again, she's 84 years old, so she probably has some medications. So there could be complications of like, how can she still receive whatever medications that she might need.
Great, thank you. And this is the one we talked about online, so we have some online responses to share as well.
Sure, thank you. So our online participants, in addition to all that, there was a lot of discussion of, so we know she lost her partner of 43 years, but there's no mention of her other social support, so potential feelings of loneliness, isolation, and some of the challenges that can come along with that in a hurricane. We also discussed the potential for medical discrimination or fear of medical discrimination, and how that could potentially, she may hesitate to reach out for medical attention if she requires it. And let's see. And yes, and a lot of discussion as well about her mobility issues and how that could have impacted her ability to prepare for the storm in advance and wait out for help if she was able to get canned food, those sort of preparations as well.
One thing I was thinking about as people were talking is that often when there is an extreme weather event, there's also forced evacuations and curfews. And some people are at greater risk of being targeted, profiled, if they're found in places that the officials think that they should not be. And so that is added risk. And then if it's discovered the person's also trans, that could add extra risk and extra challenges there as well. So it's a policing issue, and you don't have your normal police often. You have the National Guard who are coming in and during those times. So you've done a great job at highlighting some of the many risks that these folks face. Now the next part of our discussion is to really start doing some problem solving. There are going to be more storms. So in our pre-disaster planning, what can we do? So the second question, your second discussion question, is based on the challenges you outlined for the people in your scenario. What are some possible preventative measures and system changes that can address these so that we can avoid them? And as you're doing that, consider also what co-benefits may come from this intervention, so that even if there wasn't another extreme weather event, how might it make people's health better, the community stronger, just by having some of these interventions? So getting back into your groups with the same scenarios, have a chat for about 7 minutes or so about some possible preventative measures and systems changes. And I'm going to come back here with our online people. So, you've had a chance to think about this online, folks. What are some possible preventative measures and systems changes? And in a way, you already brought it up with the question of, like, you know, are LGBTQ people involved in the preparations? And I think just having them involved is definitely one of them. Nothing. So I'll just wait for y'all to think and start sending in some of your thoughts. One thing, you have something?
Hi, yes. I was thinking perhaps another, for number one, there could be specific shelters that were basically categorized as being a safe space. And that could be, there could be a list or an inventory in so that folks will know that this is, it's comfortable for me to be there and they respect who I identify as and those kind of things.
Yeah, and there are already some spaces in the community that do that. There might be an LGBTQ resource center or community center, and maybe work with them, with public health officials, to see how can we have this be an emergency shelter or at least a drop-in place for people. I've also thought about, you know, what happens if we do have a list, you know, find out who are all the seniors in the community, and then even maybe partner them with a younger person who is sort of like an adopted grandchild, to check in with that person on nice days, but also before, during, and after an extreme weather event. And I think the co-benefit of that is you've got this cross-generational sharing of people who are, you know, in an affinity group. So like you have a young person who maybe nobody else in their family is LGBTQ, so there's certain things about that it's hard to talk about their family, and they have someone who's a lifetime of experience, and that could be a really great community building.
We have a comment from Emma saying, make sure that the local public health and emergency response departments are working with trusted organizations that already reach and provide services to the LGBTQ population.
Excellent, yeah.
We also have some more comments on There should be someone specifically trained to assist vulnerable populations in the first responders group. Some more comment around ensuring that there are accessible shelters without religious affiliations or which openly accept people of all genders, sexualities, ethnicities, etc., and ensure that channels are used to get information out there about these shelters. Of several comments talking a little bit more from a communications perspective and outreach in advance of these events and ensuring that those relationships are built and that trust is built in advance of events. Let's see. We also have having up-to-date vulnerability reports in the hands of first responders can help them know where and how to reach these individuals, and a co-benefit could be close community partnerships with these agencies. And to go along with some other comments around outreach, there's a comment here about disaster preparedness training for elderly populations in-home with the home health aides and or other informed, experienced professionals, or via a workshop in the community, which could also be a social support opportunity.
I was reading an article about Rotterdam, which is a city that gets flooded and they're expecting a lot more flooding, and instead of denying the reality, they're like, okay, we need to be prepared for that. So every citizen has access to a boat and they know where that boat is, and the children have to pass a swimming test with their clothes on to kind of give them that experience. And so, but what I think about the co-benefits, when you have these sort of trainings, for instance, and preparedness, people do it together and they get to know people, and it can be actually a fun experience of getting some of this training, and it builds community. So I think community education can be really powerful, and do it within the existing structures of LGBTQ centers, places of worship that are open and affirming to LGBTQ folks. I think the issue of medications is really important too, because a lot of people are on medications, but particularly elderly people and trans people, and so to just have that be in the public awareness that when an extreme weather event comes, to remind people to get their medications, maybe even get an extra month's supply if that's appropriate to do, to help with that sort of thing. We've got about 1 more minute, so if there's anything else people want to share.
There are some comments here around getting back to some of the earlier discussion around not only having partners at the table that are open and affirming of LGBTQ communities in the planning, but also inviting them to train emergency responders about the issues that they specifically face. So kind of going along with earlier comments around getting out there and doing that outreach even in advance of an event, and some co-benefits of that could be awareness, acceptance, more increased awareness of the needs of these populations.
Yeah, it would be interesting too, having a task force of first responders who themselves are LGBTQ, and just what happens when they get together to talk. What might they come up with that their peers may not have thought of, just because of different experiences. All right, we're going to bring the group back together. See, the group doesn't want to go back together. They're having like these intense, good conversations.
Yeah, they don't. I don't.
All right, we're ready to report out. I hate having to interrupt people because you're like having these really great, intense conversations. All right, so going through our scenarios again. We don't have to go in the numerical order if you don't want to. We don't have to be that way. Who would like to go first? All right, what scenario are you again? Remind us what scenario you're in.
All right, so we are in scenario 3 with Xander, who is a 16-year-old queer from from a tribe near El Paso. So Xander has asthma and he also doesn't have health care. So some of the issues that we had going in systematic changes that we thought about was that there could be mobile clinics that go around before these hurricanes or natural disasters occur that ensure that people have adequate medication, to ensure that people have the education to know what to do surrounding if they have asthma exacerbations or not. Another thing we thought about was having mapping done to show where, after the hurricane, if you weren't able to evacuate, where you would go to pick up food and also water supplies. Another idea that we had was pumping in a lot of outreach education to the homeless community and specifically the LGBTQ community so that they know what to do in terms of the hurricane when the hurricane does come. Another interesting idea we had was having host families so that families that don't have, whether it be the monetary or they might have physical needs that can't get out, you can have a host family in a different state that'd be willing to host you for that time. Yeah, I think that was it. And we also spoke about having mobile access spots so that people can check in with their families. So Facebook has the beautiful application where if there's a disaster, you can go in and you can say, I'm okay. So maybe there can be spots where we can have people ping in to let their family members or friends know within their community that they're okay and where they are.
Thank you very much. Does anyone in the room have any response to this or any thoughts? Sure. Come just a little bit closer to the mic, please.
So as you were talking about the I Am Safe Facebook app, I was thinking also about Airbnb because they were part of working with that and how they could help with this idea of having people where they could go and be safe, where they could go and be hosted. And so continuing on that idea, yeah, I think that would be a really brilliant idea to work on this topic.
Anyone else want to talk about scenario 3 before we go to our next one? All right, who wants to go next? What scenario are you? 4, come on up, scenario number 4.
So a lot of our suggestions had to do with planning and preparedness. So in some of these kind of climate adaptation plans or these disaster preparedness that communities incorporate, we need to make sure that these are equitable plans and preparedness plans so that communities of color, LGBTQ communities are considered in terms of what different vulnerabilities are they going to be facing than, you know, the general population, and make sure that's considered. Also, just in general, improving access to mental health services. If we can get more people into care before these events, and we can ensure better planning for continuation of their care afterwards. And then in terms of afterwards, with a lot of these mental health impacts that are associated with these disasters, that we can get people treated for some of these stress disorders that come along. Also improving some medication access. I love this mobile home or mobile clinics to help with that solution. And then in terms of some of the government agencies with the FEMA and NOAA, there's programs such as Americans Prepared-a-thon and Weather Ready Nation. So possibly recruiting some ambassadors from these marginalized communities to make sure that they have input into these programs that are in place to help protect these communities and help rebuild these communities after these natural disasters.
Excellent. Does anyone else in the room have any response or thoughts around scenario 4 or reactions? So what was said was that the co-benefits of this really taking action helps everybody. Excellent. So, who's next? Which scenario? Scenario 1? Great. Thank you.
All right. So we had Luz, who's a 29-year-old mother of 3 children, and she's an undocumented immigrant, and her husband, Octavio, is out of the area in California. So the challenges in this scenario, a lot of the challenges are going to relate to her citizenship status. So the first thing that we came up with is the potential to pass a Clean Dream Act and include familial benefits. That might help out a little bit. Obvious co-benefits of that one, pretty wide-reaching. Another one would be to ensure that Border Patrol operations do not endanger lives. So if they're setting up checkpoints during evacuations, that's clearly something that shouldn't be allowed to occur. So making sure that that's not happening. Another thing we talked about is making sure that there is on-file multilingual advisory language so that when these evacuation notices are going out, they can go out in multiple languages at one time. Typically, we had the benefit of having someone who works in the CDC in our group. So typically, we learned they do go out in English and Spanish at the same time, but for some of the other languages, they might not have as many on file as are needed. And so making sure that those are up to date with especially climate change specific types of scenarios. So things like fires, floods, extreme heat, that the language is there for those advisories to go out. And then another thing that we discussed, last thing, was ensuring that there's no citizenship requirement to receive aid in these disaster situations so that that aid is available to everyone.
Thank you. Thank you for that. Anyone want to add anything else for scenario 1?
Yeah, when he spoke about making sure you don't have to have citizenship status, I think it's also important, like if it'd be easy if we didn't have to have IDs in times of emergency to access, necessities for basic health, whether it be that you need to get in a shelter and your ID doesn't match your gender, or whether you don't have a government issued ID, that shouldn't hinder whether you're able to live after a hurricane or not.
I'm also thinking with this scenario, often there are some faith communities who, it's a real big part of their mission to welcome the strangers, and in particular working with undocumented folks, and how can we partner with them so that they're better prepared with public health issues before, during, and after extreme weather events as possible places of sanctuary even during these extreme weather events. So what's our next scenario? Which one do you have? Number 5, and that was our online one too.
All right, so number 5, she's our elderly female who is a trans woman who's lost her partner and lives on a tight budget with some mobility issues. So some of the thoughts that we had were, for whatever barriers there might be for her feeling comfortable, potentially going to an evacuation shelter, realizing that she will probably have a lifetime of sort of potentially self-esteem or discrimination. Certainly we can't turn back time on that, but hopefully going forward in our society that we can prepare our society to be more inclusive. And then since we can't turn back the clock, making sure that she has support systems before disasters in order to feel more comfortable in her identity and within her community. As far as in these particular scenarios, if there are systems to track where elderly citizens are that may have mobility issues, so that in times of crisis, there could be efforts to go directly to those citizens. She gets Social Security, so it should be pretty easy to figure out where she is and how to get to her. Or to have a buddy system so that someone is looking out for her and going to check in on her if she can't evacuate on her own. And then similar to the mobile clinics, prior to the disaster, before it's deemed that evacuation needs to happen, having someone go and deliver at least enough resources so that she had bottled water and food for a few days if she were going to shelter in place. So delivering those kinds of things, and she wouldn't be able to go get them herself.
Great. We had some responses online too. You want to share some of those?
Sure. In addition to that, we also had some discussion on getting folks from these communities to the table prior to these events in terms of planning and including their perspectives in planning efforts. We also had some discussion of let's see, cultural competency training for first responders and for all institutions, and as well as a discussion around finding those organizations that already have existing relationships with vulnerable populations and finding ways to support and provide them with resources during these events as well. And a couple of mentions of similar to like a buddy system, but kind of neighborhood emergency preparedness groups, emergency preparedness community building at the block level, and some of the co-benefits of that would just be increased social cohesiveness on a community level.
And it's one of my dreams to have in every community this program where you can, adopt a grandchild, where an LGBTQ 20-something-year-old can be, partnered up with a senior, and that they just sort of get to know each other and particularly check in during and before and after an extreme weather event. But the co-benefit of this, if you have an LGBTQ younger person who maybe has no one in their family who's LGBTQ, it's hard to talk about those issues, and then to talk with somebody who has a lifetime of experience, and there's so many great benefits from that kind of exchange. And anybody want to add anything else about scenario 5?
Just have to add, even though it wasn't said, it's possible if a person's over 80, there might be some cognitive issues, and also at age 84, hearing and vision. And these are key things that I think our system, to be prepared for some emergencies, a la wildfires, people don't have a lot of time, and our system is sort of ready for people who are able and ready and have no problems. They don't have to run and get their caregiver if they have one. So I think thinking about the needs throughout the lifespan and the special needs for people with disabilities as well.
One more thing, when they were talking about maps and data, in New York, we all know that they took Medicare and Medicaid mapping and crossed them so that they could identify older people who were at risk. So the data are out there. It's just getting them.
Point. All right, so we're on our last scenario. Was it number 2 we're left with that needs to report out? Yes, where's number 2? Oh, here you are. I was just there. You got stuck with the job. Just put the mic in front of else.
Yes, I would like to do that. Okay, no one else is looking. Clara, who is 19, a 19-year-old mixed girl, trans woman who no longer lives with her parents. She's been homeless for 8 months, and she lives with her friends whenever she can. She's been avoiding shelters, and recently she's been living with a friend who is a gender non-binary Latinx friend who has a small studio apartment. So we discussed some of the challenges and possible solutions to the challenges. One thing that we thought of that's pretty similar to some of the other responses we've heard so far is ensuring that there is diversity in the volunteers who are mobilized for educating the population, educating and preparing the community populations before and during hurricane events. Another thing that we thought is that it's important for city and county level governments to mobilize with the established organizations that represent LGBTQ populations, any population that would be considered more vulnerable before a storm. We also recommended suspending requirements for identification and utilizing far-reaching avenues of communication, such as radio, and using radio for that reaches a variety of populations, like Hispanic radio, and radio that provides information, like music, to a variety of audiences, and text alerts as well.
Thank you. Any responses regarding scenario 2?
This one isn't actually about the scenario, but just an idea that if they were to evacuate, their benefits don't work outside of state. So in times of emergency, it would be nice if their Medicaid, Medicare, or their food stamp benefits would still be able to help them out until they got back home.
Thank you. And we have another comment from the audience as health equity as a code benefit. During the preparedness emergency plans from tribal, state, and federal entities, they should take in consideration these different scenarios, and the vulnerable populations should be at the table while they're setting up the plan. Other thoughts around the room overall regarding these different scenarios and code benefits and preventive measures? Sure. I need you to come just a little bit closer. Watch out, Kate.
Hi, Gary Harris, Managing Director for the Center for Sustainable Communities. One of the things that we do is that we work with NOAA on a broad-based program called Weather Ready Nation for All. And a lot of these scenarios are the backbone of what we're trying to do. So I'm glad to be here. And what I wanted to point out was, ironically, I'm in town because the National Weather Service was holding its partners meeting, and it was a 2-day meeting and such. And yesterday we talked about the process of getting weather service information out to communities, and then on today we talked about how to properly disseminate that information. And the notion, however, is the room was full of folks, the Weather Channel, Raytheon, all those folks. Bottom line is the notion of vulnerable populations only came up in the room because there were voices like ours in the room that said, "Hey guys, we need to make this a priority." So there were 10 tables in the room, and the table in the room, with Fire Voice and a couple others, raised this notion up and made sure that it's now in NOAA's top 10 list in terms of things to do from a dissemination standpoint of information to communities. So through these actions and through the actions of Weather Ready Nation for All, we're ensuring that the vulnerable communities are going to be protected with adequate information, training, and preparation.
Thank you. I need you to come forward, Rose.
Okay, I just had an experience this morning where trying to deal with a Hispanic group that had no capability to connect with their representatives. They went down to the building. One didn't have an ID, was turned back. The other one was too afraid within a government building to find the office where he was supposed to go. And I've worked overseas in many places, and to me, we really need to drill down into how hard it is for vulnerable populations to access the services that we think are available. It's amazing that you go down, you don't have an ID, you don't have a phone, your phone runs out of money, and how do we get that sensitivity into all levels?
Thank you. You look like you have a comment.
And we can take questions as well.
Yes, we'll open it up for Q&A. So overall, throughout the discussions from the day, or anything that might have been missing from the discussions today, if you want to bring them out. Excellent. And if there are questions from the online audience, please send them through the chat. We'll make sure they're asked as well.
Thank you very much. We were talking about this in our group, and excuse my back, that the vulnerable populations that we're talking about may be accessed or connected to different type of services that already exist. We were thinking about the HIV mobile outreach units or the needle exchange units. That's thinking about how we might cross-pollinate some of the communities that are already, or activities or businesses or resources that are already out in the community, and educate them about how they can educate their clients about emergency preparedness. Thanks. It took a while to get out of my mouth. Sorry about that.
Thank you. And there's another comment on this side of the room.
This may seem like a total non sequitur, but I know during Katrina and Sandy, people who have pets consider them part of the family, and shelters that don't take pets, then people have made choices to stay put. So I think we have to recognize all members of the family too, and that may be, with 4 paws.
No, actually, this came up when we were talking about scenario 5. That if Diana in her 80s had a pet, it's really probably unlikely she would maybe not want to evacuate, because emergency shelters often do not take pets, and you have to leave that animal behind, and that's your companion. It's it's more than it is a part of the family, and so that becomes a big issue. ID has come up so many times, having documentation, and from a systemic issue, this is often state. Every state has a different law. So for trans people in some states, it's significantly easier to change their ID, and others it's virtually impossible. So a systemic change that definitely can take place is working on systems for people to get proper ID that is government issued ID that reflects who they are for folks. Other questions or comments either from online about anything that we've talked about in our workshop today?
So we didn't really get to co-benefits all that directly, but one of the things we thought was with removing the requirements for citizenship to receive federal aid, or the ID requirements. If you take that away, it increases, or it makes it faster for people to get the help that they need. And in emergency response, time is of the essence. So the bureaucracy sort of reduction would be very beneficial across the board.
What if there was a federal law, systemic change, that as soon as that it was declared a state of emergency, that immediately you don't have to worry about all of the negative consequences of not being documented, so that you don't have, because one of the problems with Harvey, they made an announcement that you don't need to worry, but not everyone got that announcement, heard it, and not everyone believed it. But if it was in the system and it was understood that when this happens, then it changes that part of it, then it's more like people would more likely go and receive the benefits that they need when they need it, as opposed to avoid medical care at a time when they really need it.
So on that note, I can speak for the medical emergencies. We have federally said you do not have to have an ID to come pick up meds in a mass dispensing or a mass inoculation event. FEMA hasn't taken that stance yet, but that is what CDC and HHS have worked on for several years now.
Other questions, comments?
So the issue came up of how psychotropic drugs for people with mental health issues can make them more heat sensitive. I'm just wondering if hormone therapy can also have that kind of effect, or other medications that a trans person might be taking as they're moving from one gender to another.
I don't know, does anyone know the answer to that question? That's a good question to find out about. I mean, there are all sorts of different types of hormone replacement therapy. So I would imagine that people are told what some of the side effects and the symptoms are, but it would be good if that was just general knowledge to have out there for the practitioners who are working in that area. Yes.
I'm just wondering if you can talk a little bit about the strength of the LGBT community in providing information not depending on the general information, but there's an underground in every city. So how much can they be mobilized to help people understand what they're up against and how they can be helped?
Yeah, definitely. There are all sorts of structures. There's press, even, there's, specific LGBTQ press that, in every city there are magazines, there are newspapers and all that disseminate information, posters as well. Even at clubs, a lot of times I'll go into a club or an LGBTQ establishment and there's a poster specifically raising awareness about a particular issue. And so I think that part of it is getting it on their radar. And what I've found as a gay guy doing climate work, that there are a lot of LGBTQ people who are sympathetic and they recognize that climate change is real and we have to do something. But in a way, it's almost they feel like, well, we have bigger fish to fry. And this happens a lot with people who are marginalized. There are actual things happening right now that I'm dealing with. I don't have time for something that I feel hopeless and helpless to do anything about. And what I like about this discussion, and I think these are going to be my closing remarks to this, is this is an amazing opportunity to, to see these co-benefits happen in these communities at this time. I think what happens with climate change, people feel I can't do anything about it because they're thinking about the policy and the legislative and how we're going to respond to mitigation and all. But the reality is we already are seeing extreme weather events. And that's something we can begin to plan on locally and make an immediate impact on our communities. Every community has disaster plans that they've had to, they're mandated to put together. You can ask to see what those look like and raise questions. Well, what about this population? What about that population? And I think for people younger people in particular who feel like, well, what can I do? It's like, actually, you can do a lot within your local community to save lives by doing that. Is there, what's that? Yeah, and I think this is one thing with climate change is we need to talk more about it because people aren't talking about it, especially if they have lots of other big issues that they're dealing with that are right on top of them as opposed to something that feels like it's coming in the future. So I'm going to hand it over to you for the final remarks, and then we'll have a little reception. Sorry, folks online, you can't eat the food, but
hopefully the folks online are snacking at their computers right along with us. Those in the room, there's plenty of food outside, so as you leave, please take some food with you. We're really grateful for your participation today. The thoughts that you've shared, the discussion has been very robust. I've learned a lot in the process, and I've really appreciated the conversation that you all have shared and the time that you've shared with us. I'm sure we could go on for hours, if not days, having discussions around this topic. So this isn't goodbye. This is see you later. We need to continue the discussion. I want to thank our esteemed co-host, Peterson Toscano, for sharing eye-opening information with us and leading thought-provoking discussion with our group. We also thank you, the audience, for participating both here in the room and online. We want to remind you that none of the work of the Year of Climate Change and Health would be possible without our partners. So please sign on to apha.org/climate and become an individual or organizational partner. Up next, there's a Twitter chat on the Clean Power Plan hosted by the Natural Resources Defense Council on December 11th at 3 p.m. Eastern, and there's a webinar called Connecting Climate and Health Co-Benefits to Community Benefit Strategies, and that's taking place Tuesday, December 12th, also at 3 p.m. For more information, once again, please visit apha.org/climate, and on behalf of myself and Peterson and the American Public Health Association, we thank you for your time and participation.